Well, good morning or good afternoon, depending on which side of the world you're on. Welcome to our panel today, and it's really set in the context of that police have served over the last year or two in extraordinary times, with mass public demonstrations, calls for defunding, and also, of course, a global health pandemic. So even in isolation, these events are significant, but their co-occurrence drives an urgency to understand the impact on police wellbeing. Today we have three speakers, and I'll briefly introduce them now in the interest of time. So Dr. Tom Coughlin will kick off our panel and be our first speaker. He's a clinical psychologist specialising in police and public safety and a retired NYPD detective, and he operates a private practice in New York where he exclusively treats police officers and their families. I'll then do my presentation. I'm a policing scholar from the Griffith Criminology Institute in Australia, and I've got over 20 years experience working as a practitioner and researcher. And then last but not least is Sherry Martin. Sherry Martin is the National Director of Wellness Services for the Fraternal Order of Police, which is the largest representative organisation of law enforcement officers in the United States. I'm now going to hand over to Tom to start his presentation. Thanks, Tom.
Thank you very much, Jackie. I'm just going to share my screen. Okay. So hello, everybody. Jackie, thank you very much. Happy to be here. Thanks very much for joining us. My name is Tom Coughlin, and as Jackie said, I'm a clinical psychologist in private practice where I exclusively treat police officers and their families. And the things I'm going to be talking about today come from mostly my clinical observations in private practice, as well as some of the things that we've been seeing coming out anecdotally and some qualitative research that's been coming out, and some of the narratives that are being produced regarding what's coming out clinically from officers who are reaching out for treatment or who are struggling at this time or come to the attention of the department for stress-related reasons. And so when we look at the degree of threat that police have come over in the past year, we see numerous novel threats coming forward. And although we've faced similar threats in the past, we have not in the past faced combined threats of this much of a landscape scope combined together at once with multiple threats coming at us on an international or national level. So we think about the numerous threats that have come to policing over the past year. We can think about the threat from the pandemic, obviously, although we could say, well, the entire world is facing that threat, right? The entire world is facing it, but the entire world is not out on the front line dealing with it day to day, out on the front line, you know, as essential workers, not being able to shelter in place, not being able to quarantine, being forced to be out there on the front line day after day since the beginning. And so there's a real threat to safety, well-being, and overall health, as well as the threat that comes with worrying about bringing COVID home to your family, right? And so multiple threats to one's physical safety, well-being, health, long-term health coming from the pandemic. When we take that in concert with the mass protests and the social political unrest that we've seen since the George Floyd incident on Memorial Day last year, and we see all the mass protests that came forward from there and the social political unrest that came forward, there's a real threat to physical safety with increased assaults against police officers and a real threat to our identity. And threats to our identity can come in different forms, right? They can come in threats to our competence or our morality, meaning that you could be threatened with your identity, that aspect of your identity is incompetent or unable to perform, or a threat to your morality, right? So we can say, for example, when we look in the aftermath of the Capitol riots, and we know that the Capitol Police have come under siege since then, with a lot of accusations of them having been ill-prepared for those riots or unable to handle those riots when they came. And so there's a real threat to their competence there, right? And so overall, police have largely been coming under these threats to their identity. And we see the defund the police movement. We see threats to officers' career. More and more, I'm seeing officers come into my practice struggling with wanting to retire or resign from the department, or resign from this department and move somewhere else in the country that maybe is in a geographical area that's more favorable to police. And so the real threat to that, the real threat to their career, and the threat that comes along with reduced resources, with having funding pulled back. And so when we see these three threats taken together, it's something that we haven't seen before. It really isn't an unprecedented degree of threat that police are currently under. So the clinical observations that I'll be discussing today come from not only the work that I'm doing with local police in clinical practice, but I also work with federal agencies and a number of metropolitan agencies in the New York, New Jersey area. And so the work that the clinical anecdotes that I'm bringing today come from a vast and diverse population of officers of all agencies, of all ranks, coming into my office for clinical treatment needs based on a lot of the threats that they're currently under and the increased stress that they're operating under. And what are some of the things that I'm seeing clinically? What are some of the things that I'm seeing in my practice? Well, I'm certainly seeing increased burnout, right? And burnout being a combination of exhaustion, cynicism, and a low sense of accomplishment. So certainly what we've seen over the last year is our officers being expected to do more with less. And that does lead to a high degree of emotional exhaustion, physical exhaustion. When we see high rates of absenteeism, typically, and I'm just using the NYPD as an example, although that's not the only agency that I'm speaking in regard to, it's not the only agency that my clients are from. We look at the NYPD just as an example. Typically, anywhere between 2 to 3% of the department might be out sick at any given point in time. The height of the COVID pandemic, up to 9% of the agency was out sick. That's unprecedented. It's just unheard of. And so the rates of absenteeism going up mean that there's less cops out on the street to provide backup, to respond to calls for service. And so you're being asked to do more with less, right? They were having their tours changed. They had their days off denied. So they were working 7 days a week straight. They were doing 12-hour tours 7 days a week for weeks on end. All right. And so the amount of emotional exhaustion, physical exhaustion, the time away from your family, then coupled with the fear of getting COVID yourself or bringing it home to your family, especially in the early days when a lot was unknown. The degree of cynicism that I see coming into my office has really increased. This sense of, make it a point to never love the job because the job is never going to love you back. I've seen a real increase in that kind of cynicism, that sense of feeling really detached from the job, a sense of agency betrayal or lack of support from agencies, or even resentment against other officers, feeling that at sometimes sense of resentment that other officers were making less than sincere use of quarantine opportunities and sheltering place opportunities. So if you just call into your agency and you say, hey, my kid had a positive exposure at school, I have to quarantine. The sense that not all of those calls were sincere and a real sense of resentment that comes from that. And a sense of ineffectiveness and low accomplishment, a sense that there's a lack of reciprocity, not only from the community, but from the agency as well, and a sense of betrayal from agencies as well. I'll talk a little bit more about that as I go on. So for example, we see mixed messaging sometimes. So for example, here in New York, right, and we saw this throughout the country, but we see supervisory staff taking a knee. So here you'll see up front, when faced with a mob demanding that they acquiesce or that they defer, we see supervisory officers taking a knee, while in the background, you see the rank and file police officers standing tall, right? And so a real sense that your agency has betrayed you, and that leads to a true sense of resentment and feeling that my agency will not support me. Why should I go out there and bother taking any action? My agency is not going to have my back. If my agency wants me to just stand down, then fine. I'm just going to stand down and I'm not going to deliver any police services whatsoever. But then at the same point, there's a mixed message also, because in the months after high-ranking executives in the police department took a knee and made a political statement in uniform, a lower-ranking police officer was given disciplinary action for wearing a political pin on her uniform. And she was disciplined because she just happened to randomly be caught on video in a crowd wearing a political pin on her uniform. And she was disciplined because she should remain apolitical at all times. So how can you make a political stance in uniform on one hand, but then be disciplining lower ranking officers from supposedly making political statements for wearing a pin? It's a total mixed message. It's a real sense of betrayal and a true sense of resentment that's coming more and more, that I'm hearing more and more, a true sense of cynicism and detachment from their agencies. When we look at policing metrics, when we talk about what makes good policing, right, we can say that we can measure good policing a number of different ways. We can say that policing is good policing is measured by the amount of enforcement actions that we're taking, how much police action we're doing out in the street. So if I made more arrests today than I did yesterday, that's good policing. If I gave more summonses today than I did yesterday, that's good policing, right? We could say that. We could also say that if we reduce negative outcomes, so if we drive down rates of absenteeism, if we drive down rates of citizen complaints, if we drive down the rates of unjustified officer involved shootings, right? If we reduce negative outcomes, then we could say we're doing good policing. If we say that we're increasing the level of employee satisfaction, increasing the level that our employees feel committed and engaged in their work and dedicated and devoted to their agency, we could say that we're doing good policing. Or we could say the degree to which the community feels partnered with by the agency, that the community believes they're being delivered good services. We could say that's good policing. That's a metric of good policing. Regardless of what metric you use to measure good policing, every one of those metrics will be negatively impacted by burnout. If you have a burnt out police force, every one of these metrics will be negatively impacted. And I'm seeing that more and more come into my office as a result of the multiple threats that we're being faced with now. And then those negative outcomes that I'm seeing is low levels of commitment, resentment, acting out behaviors, externalizing behaviors, higher rates of off-duty misconduct, higher rates of maladaptive coping behaviors. When we talk about policing under the threat to identity, what that means, right? So what does it mean to be under a threat to identity? Well, the defund the police movement, the anti-police hate rhetoric that we've seen have certainly created a threat to police officers' identity. That threat comes to their competence, meaning that they're simply not good at their jobs or they're incapable of policing, or to their morality, saying that they're bad cops, right? Taking individuals and holding an individual accountable for an entire group, or holding an individual accountable for historic events that have happened in the past. And so we're seeing more and more of these threats to officers' identity and a real sense that we're not wanted, that we're devalued, et cetera. More and more of that is coming into my office. And so how do we respond to these threats to identity? Well, I'm seeing every one of these in my office in clinical practice from across a variety of agencies and jurisdictions and all ranks. We can respond to threat to identity, and I'm certainly seeing this performance decrement, meaning saying I'm just going to go dead on the job. I mean, I'll show up and I'll put on the uniform and I'll sign in and I'll take my meal and I'm sign out. But if you think I'm showing up to any jobs over those 8 hours, or I'm going to hold my jobs as long as I can. So before I give a disposition, I'm going to sit on this job for 20, 25 minutes, a half an hour. I'm going to milk this job for every second I can. And if the sector goes into backlog and we're holding jobs and people aren't getting response to their calls for service, oh, well, sorry about that, right? I'm seeing more and more this sense of performance decrement come in. These kind of acting out behaviors. I'm seeing a lot of upward disciplining in the agency. So I'm going to call a sergeant to every single job, right? Every job I'm going to make the sergeant appear. I'm going to upward discipline the agency and slow everything down. Dehumanization of the outgroup, right? So there's an us versus them, an in-group versus out-group. And if we dehumanize an out-group, it's easier to aggress against them, right? And so I'm seeing dehumanization against the out-group, so more of that. In-group denigration. So if a person within your in-group doesn't necessarily agree with your belief or the belief of the group as a whole, you identify black sheeps. And you kind of ostracize them. And I'm seeing some of the ostracized people coming in and some of the ostracizers as well. Derogation, derogatory social media posts against the out-group that cops are being disciplined for, et cetera. I'm seeing a lot of concealment, meaning cops hiding their identity as police officers, telling their kids, don't go to school and let anyone know that your dad's a cop. Don't wear any kind of supporting the police memorabilia. I know cops going out and tearing off bumper stickers off of their car so that their vehicles don't get vandalized while they're at work, sitting outside the precinct, or covering up bumper stickers with other kinds of political statements bumper stickers, or taking down the blue line flag off the front of their house so that their house doesn't get vandalized. I'm hearing a lot of this concealment behavior. Positive distinctiveness, pointing out, so getting into arguments about why their way of believing in the world is better. And identity exit. We look at the attrition rates and the retirement rates, they're absolutely through the roof. They're down here. I mean, here, at least in New York, the pension section has had to really limit the amount of pension applicants that can come in on any given day because they're overwhelmed. And changing the meaning and the importance of the job, what it really means to you, and deciding that, you know what, this job doesn't actually mean that much to me anymore. And when I think about it, it never really did anyway, right? Really changing a sense of commitment and meaning in regard to the department because of all of these threats. And what kind of maladaptive coping am I seeing? I'm seeing quite a bit of it, and quite a bit of increase in it. So we think about active coping styles, right? Active coping styles are those styles that deal directly with the issue at hand, where avoidant coping styles don't deal directly with the issue at hand. They might de-stress you, but they don't really deal with the issue. So for example, I have a day when I'm completely overwhelmed with work and I can't figure out how I'm going to get my work done, and I'm totally stressed out and overwhelmed. I don't do anything at all. I go into my kitchen and I sit on the kitchen counter and I eat a pint of ice cream, right? When I come back from eating that pint of ice cream, all the work I had is still sitting there waiting for me, right? So I might have avoided it and I might have de-stressed, but I got nothing done. I'm seeing that kind of avoidant behavior come into the office. More of use of maladaptive coping strategies than adaptive. So adaptive coping strategies are healthy, they're effective, they actively engage the issue. Exercise, meditation, involvement in support groups, relying on social support, etc. What I'm seeing is more reliance on maladaptive coping mechanisms. So unhealthy, ineffective, avoidant coping mechanisms, risk-taking activities, acting out, externalizing behaviors, increase in all sorts of negative maladaptive behaviors, such as an increase in alcohol use and self-medication for anxiety and depression, an increase in online gambling, right? As more and more people are confined to their house and they're looking for ways to entertain themselves. I'm seeing increases in online gambling. I'm seeing increases in infidelity and what I might call reverse infidelity. And what I mean by reverse infidelity, and this one I didn't see coming. When this one started coming into my office more frequently, this one kind of surprised me. So the COVID, the pandemic, creating a situation where we're all back in the house together and we're out less together, means that anyone who's out in an extramarital affair can no longer engage in that extramarital affair because of COVID. And so now they've lost the emotional support of their extramarital affair, and now they're confined with the person that they were trying to get rid of. And we're seeing the effects of this, right? So something I didn't predict, but I'm seeing a lot of what I'm calling reverse infidelity more and more, causing problems in the home. And seeing people using overtime, maximum mass amounts of overtime as an avoidant coping mechanism. So if I just don't have to go home, I just don't have to deal with it. And they're burning themselves out, soaking up every cent of overtime that they possibly can. And these are many of the clinical things that I'm seeing come into my office as a result of the stress that our police are operating under over the past year. And with that said, I will hand the screen to Jackie.
Thanks so much, Tom. Okay, and thanks, Tom. And I think that many of the things that you've just been talking about really segues nicely into the research that I'm about to present that was done in collaboration with the next panelist, Sherry Martin from the National Fraternal Order of Police. So what we know is that police represent an already highly stressed and at-risk population for mental health concerns. And we know that police are reluctant to seek help due to that cultural stigma. So myself and Sherry from Griffith and the FOP were interested in understanding very early on what the mental health impacts of the health pandemic may be. So we needed to think about what were the potential unique and compounding impacts that we might see from COVID-19 on our law enforcement officers. So just to give you some contextualization about the impacts of COVID-19 compared to other incidents and issues that we see in policing more generally. So the rate of death experienced by police in the COVID-19 environment, in most cases, are exceeding the yearly death and trauma statistics that are usually found in US policing. So in terms of death, at the time that our survey analysis was undertaken, we had lost 245 officer lives to COVID-19. Now that's up to, and I think it's increased since then, 426. If we compare that to 40 officers that are killed in the line of duty, or 156 officers who die by suicide. We also, of course, can have a look at the comparative with injury and sickness. So there were some reports in the first early 3 months of the pandemic that over 5,000 members of the 38,000 strong law enforcement community of the NYPD had been medically impacted in some way, which represented approximately 13% of their workforce being out sick. And as Tom said, that's not only the officers that are out sick, it's the jobs that pile up with understaffing while those officers are out. And we also compare that to 257 officers that are shot in the line of duty each year. So COVID is having a significant impact and something we need to take note of. So research that Sherry and I conducted before we undertook this study looked at COVID-19 compared to other significant critical incidents, such as 9/11 and Hurricane Katrina, because we were really contextualizing COVID-19 as a critical incident that was facing law enforcement. Of course, one of the key elements of critical incidents is a personal threat to safety, and that predicts poor mental health outcomes. So we look at risk groups. So for COVID-19, police undoubtedly were in a high elevated exposure risk. So it was infection rather than critical incidents where we see weapons or people or a visual disaster that law enforcement have to respond to. And as Tom mentioned as well, it was not only to self, but it very much the threat was to families as of the law enforcement officers. So law enforcement attend critical incidents. That's what they do as part of their job. But it's often and usually short-lived and geographically confined. What we saw in the context of the global health pandemic is it potentially impacted on every officer in every shift throughout the world. And our study represents one of the first empirical studies of the mental health impacts of COVID-19 on both US officers, and also we looked at their families. So the sample came from members of the National Fraternal Order of Police, who is the largest organisation of sworn law enforcement officers in the world, with over 355,000 active and also retired law enforcement members. Our survey first opened in June 2020 and still remains open today as we continue to collect data. And the research that I'll talk about is based on an initial pilot sample of 219 active officers. So about 82% were male. The largest group were at the rank of corporal and sergeant, and 5.3% of our sample had been diagnosed with COVID-19 at the time. So what did we find? Well, firstly, we were interested in exposure. What sort of exposure were law enforcement perceiving they had to COVID-19? All but one officer in our sample did indicate they had some perceived level of exposure, and almost 60% indicated that their exposure as part of their work was high or very high. We were very interested in understanding the police agency support, and that was both from a physical safety perspective as well as a psychological safety perspective. Most officers did feel positive about the support of their agency regarding the physical safety and PPE provisions. And of course, that increased over time as PPE was rolled out to more agencies. But if we compare, and of course our research was very much focused on the psychological impact, if we look then at what the officers perceived with the agency support they received for mental and emotional stresses, we see a bit more of a negative story. We saw that just over 35% of our sample felt that their agency supported those stresses and them coping with those stresses during this time. So prior to the pandemic, and I mentioned at the top of the presentation, that we're already, as we know, talking about a highly stressed population when we're looking at law enforcement officers. So prior to the pandemic, 33% of officers reported already having experienced high and very high stress as a result of their work. We then found that almost 80% of officers reported that those stress levels were slightly higher or much higher now during the COVID-19 incident. An interesting finding was that we actually found non-significant differences between level of exposure and stress levels. So this is unusual because research with other types of critical incidents usually show that greater exposure will lead to greater stress and mental health impacts. What we concluded from this is that COVID-19 may actually be a type of critical incident that's different. It may have a broader impact than critical incidents we've ever seen before. So there might be different mental health prevalence outcomes as a result of COVID-19, and there also might be a different trajectory of ill health over time. So we can't simply just rely on our previous research and our knowledge around usual critical incidents in policing. So we specifically asked officers to compare COVID-19 experiences to previous critical incidents they had gone through, things like officer-involved shootings, violent encounters that endangered their life, or the suicide of a co-worker. Almost 60% of our officers agreed or strongly agreed that they had experienced more stress as a result of the critical incident of COVID-19 compared to those stress that they had experienced as a result of the critical incidents that they had previously encountered. So this is a quite impactful finding. Of course, we were very interested in understanding what the sources of pandemic stress are. So again, we looked at previous research to make our best guesses, our hypotheses about what we might find. So speculation drawing on previous research on emergencies and disasters would probably lead us to believe that stress would be elevated due to the fear of personal infection. What we actually found was a little surprising, but made sense once we saw it, is the greatest sources of stress actually came from fear of infecting family members and also enforcement of restrictions. And Tom talked about that in his clinical practice, that he's seen this agency impact on officers. So you can see there that the data and high and very high stress as a result of infection of family and enforcement of restrictions. So if we drill down on enforcement of restrictions, we know during this period of time, there's been significant tension between the role of police in the enforcement of restrictions throughout communities. So this has been within policing, within the agency itself, and Tom gave some great examples of that, between the police and the community, of course, and between police and government mandates. So there's really a growing body of evidence that mental health is strongly influenced by the support that officers receive from their agency. This is a critical lever that we need to understand in managing the mental health of our officers. During COVID-19, officers felt themselves conflicted by enforcing mandates that kept changing. They were being critiqued heavily by the community, and we, of course, saw those mass demonstrations occur at a very similar time. And officers did not feel that their organisation had their back. They were left to hang out to dry in terms of some of these mandates they were asked to enforce. Looking at family members, officers' usual stress and worry is almost always about coming home safely to their loved ones at the end of their shift. The families of law enforcement officers' usual stress and worry is about the danger to the law enforcement loved one that goes off on that shift. What we found is almost 75% of the sample reported family stress was higher or much higher than usual during COVID-19. It created an atypical perceived risk for families, and exposure in this instance was related to perceived higher family stress. Greater exposure of officers, the more stress their families were likely to experience. So what are the longer term impacts? We know from critical incidents, it's not about just the immediate aftermath of a critical incident that we need to be concerned about. We need to look at the longer term consequences. And we saw this with both Hurricane Katrina and 9/11. 39% of officers felt that they would have long-term mental health impacts from COVID-19. And those who reported greater stress during the COVID-19 period reported greater perceived likelihood that they would have these long-term effects. Families also, over 50%, felt that family stress would be elevated more generally about the changes of police work, and those who perceived higher elevation of family stress were also more significantly likely to feel that families would experience longer term impacts from the experiences of COVID-19. So Tom's already talked about, what the co-occurring incidents are. We add then to COVID-19, public demonstrations, calls for defunding police, and this overwhelming sense of a lack of perceived organisational support. These are things that all that need to be on our agenda, looking now and into the future about the mental health of our officers. So COVID-19 has undoubtedly elevated stress in police populations. We need to consider the impact and relationships between co-occurring critical incidents that happened in 2020 and what that means for mental health in the future. We need adequate support services, short and long term. We need support programs that are multifaceted and understand the uniqueness of COVID-19. And we need to identify specific cohorts of police that may require specific support and targeted support. They are the at-risk groups that we will have. Thank you so much. I'm going to stop sharing so I can let my colleague Sherry take over.
Thank you, Jackie. Let me just share my screen here. And I see that we have a few questions coming up. So I'm going to try to get through this a little bit expeditiously so that we have time for the questions at the end. But in the meantime, so Jackie and Tom have done a great job of getting us to this point in the presentation. And Jackie gave an overview kind of what I'm going to talk about here at the beginning of my piece about some of the recommendations that we found from the research that we did and thinking of the pandemic as a protracted or a prolonged critical incident based on review of other mass incidents and their after effects. As she said, we framed the pandemic as a protracted critical incident so that we could provide recommendations and strategies to law enforcement. And if we look at the pandemic, it bears a lot of similarities to what we traditionally think of as critical incidents for law enforcement, and that it involves witnessing of death and suffering, and in many cases, loss of coworkers and threats to one's own health. So, of course, we must all also not forget about the stress added by the perfect storm of circumstances that our profession has faced, and in framing this time as a prolonged and protracted critical incident, we arrived at these recommendations and strategies for both police agencies and individuals that I'm going to talk about for not only remaining healthy and resilient during this time, but in getting ahead of these effects and circumstances and being proactive. All right, so some of the key, there were 3 key areas that we focused on with our recommendations. The first of those being support of personnel by the agency. Based on successful strategies used in dealing with other critical incidents in the past by police agencies, we arrived at the following recommendations that you see here. Support is one of the first areas that we focused on. Realizing that every individual doesn't react in the same way to different forms of support. And so support programs need to be multifaceted. They need to come in different modalities. They need to come from different sources. And there needs to be a method for identifying those folks who may require additional support. Take, for example, if you had an officer who was personally impacted by the loss of a loved one or family member by COVID, an officer who may have almost lost their own life due to COVID, or someone, let's say, who was a single parent trying to work during the COVID pandemic, and all of a sudden their child is at home every day. And so, there are going to be specific officers that have a little bit more impact from the pandemic and some of the other circumstances that we face, and might need a little bit more attention, a little bit deeper services. And so having a method for identifying those cohorts of folks and providing them additional services is key. The next area that we focused on is monitoring. So this is an area where there are noted weaknesses in the law enforcement profession as far as what we're doing in the area of wellness. For relatively, wellness in law enforcement is a rather new field. It's a rather new idea. This is only something that we've been really proactive about for the last decade or so, compared to maybe some other professions that it's been a prevalent part of their workplace for a much longer time. Only in the last decade or so have we really, as a law enforcement professions started to recognize that wellness needs to be important for us to maintain a healthy workforce. So often we apply an aid, we apply a a new service, but then we don't follow up on measuring its effectiveness or monitoring the people that are using it to see if it's actually helping them in a way that's going to be effective to go the distance for them. So we need to be able to be agile, to go back and look once we implement a program to make sure that it's actually working for people and their families, to not forget to include police families, because as Jackie already mentioned, those family relationships are key to officers. It's really become clear that families are both the biggest source of worry for officers, but also in many cases their biggest source of support. So we need to make sure that we take care of those families as well. And then finally, we need to make sure that we're measuring our effectiveness. It's not just monitoring the folks that are getting the services, but also measuring the effectiveness of the services that we're providing. It's not enough to just apply a program. If the programs we're applying are not being used or aren't improving well-being, then they're not effective. If we only have one program, let's say, if we have an administrator who says, well, I have EAP, that's good enough, I'm checking that wellness box, that's not enough. We need to have different levels of service, different methods of service available to our law enforcement officers so that we can meet them where they're at and provide the services they're going to use. And so what I'm going to do next is I'm going to highlight some of the initiatives and programs that our organization, the Fraternal Order Police, is developing to support our officers. One of the first things we did, we know that messaging was important. And, as we faced the defund the police rhetoric and any anti-police sentiment that we were feeling, I think oftentimes law enforcement officers felt that the public doesn't really understand the nature of their job. We know that 90% of those that we surveyed within our organization believe that the public really doesn't understand what law enforcement does. And we have dehumanized a lot of our police officers. And so the FOP started the I Am campaign, which gave us, a little bit of an idea of, police officers are human beings. So let's see if this video will play for us. So this is just a number of, we had a series of these I Am videos that we produced within the Fraternal Order Police to remind our communities that we are human beings. There's a heart behind the badge that we're wearing. And so, we want to remind, our communities that police officers are members of the community as well. They have other roles in life besides the job that they're doing in uniform. So messaging, that's a key part of our initiatives. Then we're developing a series of wellness initiatives utilizing member feedback from within the organization. We constantly put out surveys within our membership, one of which was the COVID survey that Jackie has already talked about. And in our research, we discussed engaging members on several platforms. We know that individuals respond, as I said, in different ways to different resources, and we want to be able to reach all of our members. Therefore, we try to find every way that we can to meet them where they are when it comes to bringing wellness into focus. I'm going to talk a little bit more about the initiatives that you see there in the slide as we move forward. We need to constantly keep wellness in the conversation in our profession, not just mental health and quote unquote feelings, but all areas of wellness. So, you know, that's physical health, it's financial health, it's family relationships, it's social relationships with friends. From research conducted within our organization, we know that the most utilized resource for support during the pandemic was printed or online material. Most cops want to be able to help themselves first without having to ask for help from another resource. And so we wanted to provide a series of places where they could go to gather resources on wellness. So we started to publish this monthly series of newsletters and have now transferred that to our FOP online journal, which is distributed on a monthly basis, and each month contains a wellness section for information. And then the next thing, we have a goal of identifying as many culturally competent resources for law enforcement as possible. We are engaged in the development of the FOP Approved Provider Bulletin, which is going to be a nationwide directory of culturally competent wellness services for law enforcement. So this is everything from individual clinicians and therapists to inpatient treatment facilities to other wellness products and programs, wellness training programs that are out there. And what we do with each of these resources as we work through them to put them in this guide, we vet them as an organization. I have a committee of 7 law enforcement professionals that work with me on our committee, and we go through a vetting process, pretty thorough vetting process. With the guidance of research and practicing police psychologists, we've created a standardized vetting criteria for identifying these culturally competent clinicians to add the directory. And the way that we did this, we built this from the inside of our organization out by asking our leaders around the country within our organization to identify those professionals that they already knew and trusted to work with, and then from there building that network out. What is resulted in so far in these early beginnings is that we have identified a number of inpatient facilities here that specialize in treating first responders. They have, you know, gone through our vetting process, been successful in earning our approval and our vetting. And this is only just beginning for us. We actually have 2 more that we've recently vetted that we are moving through our multifaceted vetting process, and several more coming in the future, along with individual clinicians that we plan to vet as well. The next thing that we are doing is, in cooperation with the COPS Office of the Department of Justice, we're building a curriculum of standardized law enforcement peer support. We acknowledge from research that we've done within the organization that peer support is key for law enforcement. That is, aside from, you know, resources that they can find on their own to educate themselves, peer support is resource that law enforcement officers want to use if they're feeling that they need support. So we are bringing consistency and standardization to this process, which is going to enable us to measure its effectiveness in the future. Right now, there is no current standard national certification in law enforcement peer support, and that's something that we're looking forward to achieving. A little bit more about the Power in Peers training. We are looking at existing programs that are already out there for peer support and law enforcement, pulling in a positive psychology component to emphasize the strengths of the individual officer and how they can best utilize those. We are asking members of our organization when they would use peer support, what they would like their peer supporters to help them with, and then what's going to happen as we develop this training and take it around the country. We're going to develop naturally a nationwide network of trained peer supporters that officers will be able to call on. So if they're still nervous about using peer support because they're worried that their coworkers might not keep things confidential, they'll be able to call a peer in another part of the country and they won't have that worry. So from this ongoing survey that we have as we develop the curriculum, we asked members within our organization if they had access to trained peer supporters, when they would use them. This data is still being gathered. We note that most would still utilize peer support most often for job-related stress, whether it's within the 4 walls of the building or it's related to the actual task. But we see here that they also would like support with other circumstances, with those family strains of stressors, with financial issues and other things like that. So very quickly, I'm going to run, and we have just a few minutes left. I'm going to offer some individual strategies for resilience. The one I want to focus on most in this slide is that we're developing a campaign within the FOP called Raise a Hand. And that means raise a hand to say, hey, I've been there before. Raise a hand to say, hey, brother or sister, let me help you. This also works with members of our community, right? And then finally, raise a hand to say, I need help. Let's work together and assist each other. And then keeping a few strategies for keeping resilience going as an individual, looking down the road, trying to keep a positive frame of mind about where we can go and where we can get if we work together, to keep educating ourselves about not only care of ourselves, but how we can, listen to the community and care about them. We need to not forget, especially to include families in these initiatives. Police officer families, I can't stress it enough, are a key source of support for law enforcement. And so we need to make sure that whatever we implement applies to them as well. And then finally, as changes in law enforcement are coming, and we figure out how to work differently with our communities going into the future, we need to think about how we can remain flexible. I know that I like to tell this story. We recently had our second annual wellness training event within our organization. And I watched one of our senior retired members try yoga for the very first time at our wellness summit. And so, that's, kind of a dual meaning. He wanted to try something new, actually enjoyed it, and learn something about himself. And and having the ability to listen, especially when we're working with each other and community members and trying to adapt to changes that are coming in the profession, we want to make sure we are able to be flexible. One of the things we do also is we vet hotlines as part of our approved provider bulletin. I like to include this slide for any law enforcement that might be out there. The FOP has vetted and approved each of these hotlines you see on this slide here, and we recommend using them as well. And then finally, this is the contact information for our committee. Should anyone wish to reach out to us for more information about the work that we're doing within the FOP, we are excited. We know we have a lot of work ahead of us, and fortunately we have great colleagues like Dr. Drew and Dr. Coughlin along with us on this journey. And so I think we have maybe just like 3 minutes left to see if we have any questions. Let me stop sharing.
Thanks, Sherry. We do have a couple of questions, and one of the questions was about some officers. What are our thoughts about the impact on officers who may not have saw COVID as a threat? And was this in some way an attempt to be self-protective, whether conscious or unconscious? To kick off, I guess, I would just say it depends on how you define threat. When we think about critical incidents or we think about COVID, our immediate thought was the fear of infection, getting COVID ourselves, being sick and potentially dying. However, what we saw from our research and the three of us said is that it may not be that perception of threat. It may actually be a threat of your organization and what impact that has on mental health. So it's really that dual understanding of what we now conceptualize as a threat. We can't just think about trauma anymore. We must think about organizational impacts. They cause 2 to 3 times the impact on mental health of our police officers. We know that now. Sherry and Tom, did you want to comment on that one?
Yeah, I'll say, just going back to, it really was striking to me, that statistic that we have there about, fear of infecting families being so far above the officer's own fear of infecting themselves. Was that a sort of protective strategy, not being worried about it? I don't, maybe for some folks, maybe, but I think what has happened in the law enforcement officer's mind is they're accustomed to dealing with hard things. They're accustomed to going out in the community, knowing that they're risking their health, risking their life. They're not accustomed to putting their families and their loved ones in that position. And so that's, it had not occurred to me even after, 20 some years in law enforcement, but seeing that statistic, it absolutely makes sense.
Yeah, and I would just jump on that quick observation, really. I don't know if it's a direct answer, just an observation. The law enforcement is just cut from a different cloth. And I guess being retired from law enforcement, I guess I have a different mentality about things. I never closed my practice during COVID, not from day one, not ever. I was in my practice in person, seeing my clients in person every day throughout COVID from day one. And my clients came in person. And months later, I'd still be seeing emails on listservs from therapists talking about when they're going to be reopening their practice. I never closed my practice, and I don't think that my clients even when I proposed going virtual, my clients wanted nothing to do with it. And so the idea of running away from it just wasn't in their fabric. And it wasn't in mine either, and I think it's a general theme in law enforcement to kind of take this thing on.
Yeah, and I think, as you said very eloquently, Tom, that cops turn up every day, regardless of what's going on in the face of danger. And that's why mental health has to be on the agenda, because we know that police will put themselves last when it comes to protecting the community, even if it's at a cost to themselves. And just very quickly, there was just one other question about rural versus urban. We didn't have a big enough sample to be able to compare rural and urban. I don't know if Sherry, you've seen from your membership, anything that would give us an indication of the differences across the country?
Yeah, I think anecdotally, it's not so much a distinction between rural and urban as it is just between each individual's personal involvement with COVID. You could have two officers from an urban area that have completely different experiences with COVID. Same thing in a rural agency. The only thing that I can think of, Dr. Drew, that we could maybe draw on is to look at those officers that say they were actually exposed to COVID or actually were diagnosed with COVID, and their level of stress related to that diagnosis or that exposure versus those who maybe, weren't exposed. But, I think there wasn't a lot of difference, even anecdotally, as I talked to officers around the country in our organization about differences between rural and urban. Everybody's been impacted by this.
Yeah. Right, well, luckily we got to the end of the questions and we're in time. Well, a minute late, we'll call it in time. I want to thank very much Sherry and Tom for being on the panel. It's always a pleasure, and I feel privileged to work with such esteemed colleagues. And thank you so much to everyone that attended our presentation. You can get our contact details. We're on LinkedIn, and also the conference and the app has our bios if you'd like to reach out. We'd love to hear from you. Thank you.
Thanks, guys.